or from a different research. Of course, it offers advantage of having access to large amount of data at a cheaper cost. But of course, most of the advantages of this primary data collection strategy is lost in secondary data. For instance, you may have difficulties with missing data and the rest of it. Now, data collection sheet, or what we call case report form. Now, this is what people used to call pro forma anyway. So this is the whole assembly of your data collection system that helps you to get all the information needed to answer your research question. So they can come in form of a paper and pencil, can also be from electronic designs. So they are always required in primary data collection, but also useful in secondary data collection. Of course, this content is guided by your research question. And recently, things like Research Electronic Data Capture provides the electronic version, of this data collection sheet. I would have given you practical tips, but that will be when we meet face to face. So with regards to data cleaning and transformation, of course, you have got your primary data. You need to check your data for what they call quality check, to check the integrity of the data, and then clean errors. And errors can arise from multiple sources. It can be during manual entry of your data into your SPSS or into any of your data analytic software. It could also be missing data. It could be implausible values. For instance, you have a BMI of 500. You know that it's almost impossible for someone to have a BMI of 500. So these are implausible values. So that tells you that there may have been an error, and it may have skewed your data from at least a normally distributed data to not normally distributed, just because instead of putting 50 or 30, you put 300. That's an implausible value. So it's always good to check through your data to see if these things are there, especially those of you who are doing chemistry. So you may want to say 3.2, and then you record 320. That is an implausible value for maybe something like you're looking for a particular, maybe if maybe let's say you're trying to look at PCV, so you have a PCV of, say, you want to write 30.2, you now saw 302. That's almost an implausible value. So it tells you that this may be an error, and it may actually skew your data if you don't take care of it early on. So you also have to deal with responders and research assistants, their fatigue. These things can introduce error. And of course, those ones that come from the instrument themselves. And then the inconsistent data collection strategies, like asking questions differently from your protocol. Somebody is doing something on depression, he says, have you lost interest in your activities? And that person wants to ask them questions, say, they like activities again, different, just asking differently may introduce errors in your research. Now, it is always good to routinely check your data at the end of every day so that you can still have access to the individuals in case there are missing values, and then you can complete it. So you check for missing data. These are defined as values that are not available but will be meaningful for analysis. And then you have to avoid data entry when you're tired or distracted to minimize errors. So if you use SPSS, I commonly encourage you to use it to enter your data when you're at your best. When you're tired, you may start putting values that are not appropriate. And maybe when you are tired, so instead of staying in your data entry view, you should go to the other part of the SPSS, which does not have the data entry. That's where you create your codes. Because if you leave it at the data entry, your child may just come in and press your laptop and then give you a value that is not plausible. So these are practical things we can do. Now, but assuming that we have, at the end of everything, we have missing data, after trying to ensure that everything is okay, we still have missing data. Now, a few things we can do in terms of handling it. There is no one that is perfect. Each of them do have their own limitations. So these are ways we can deal with missing data. One is what they call list-wise deletion. So you can remove the row that is missing. It is simple and fast, but can lead to bias because you may just remove somebody who necessarily do not want to answer that particular question because of the person's view about the question. For instance, question on homosexuality. The person may choose not to, and then you delete them. Meanwhile, these are the people that have some characteristics in question. Then the pairwise deletion means you remove the row with missing data during the analysis, during specific analysis, but not from all analysis. So this is better than the other one, the first one, because the first one you lose the data completely. But this one, you're just removing it for a specific analysis, but can still be used for other analysis. Then there's what I call simple imputation, which is, for instance, you have values like, you have mean, like values like mean, median, and mode for other respective data. So you can look at, if you have got like 3 persons who reported their age, and you have a missing age for the 4th person, you can decide to get the mean of the 3 and then just use it to fill up the other. That doesn't make it completely right, but there are sometimes you could try that. Then the other one is what we call for the nearest neighbor. So especially if you find similar observations, for instance, somebody is a male, female, PCV 20, and then you have another male that is 20, female, you may pick to the nearest neighbor, which is 22, and use it to replace that. So these are ways we can juggle, but that doesn't mean there's no one that is completely correct, but you just choose what you want to do based on the circumstances. Now, the good part of it is last one, which is last observation carried forward. This is called LOCF. Now, it's part of the things you do in intention to treat, especially for longitudinal studies, where you keep imputing the data. For example, somebody is doing a cancer research and they're following up this individual. And you're supposed to follow them up for 1 year. But somebody came, you're supposed to do month 1, month 6, month 3, month 6, and month 12. Somebody came month 1 and month 3, but did not come 6 and 12. The last observation means if he came on month 3, you keep carrying the values of that person from month 3 to month 6 to month 12. That's last observation carried forward. That's commonly used for a longitudinal study or even in an RCT when you want to do what they call intention to treat. Somebody has begun to participate in the work, but at a point it's lost to follow up. So you can carry the last values upwards, and then at the end of analysis, you want to do whether you want to analyze per protocol. That's those who ended the study, or sorry, per protocol, or using per protocol are those who ended the study, or intention to treat. That's those who started the study, irrespective of whether they died on the way or whether they were lost to follow up. Those ones are all included. All right, so data transformation, I rather want to do this more in a practical class, but the data you collected may not be used in that form for analysis. So for instance, you may have collected your BMI as numbers, 20, 21.5, 30, and all that. But you may want to analyze them as underweight, normal weight, that's what we call recategorization. So you can transform your data from one form to the other. And most of the analysis softwares can actually do that for you. Now, of course, you have to store your data properly. And it is just securely doing that to protect the health information of your clients. So it is important to think about data protection and safeguard to prevent accidental data breaches. So data collected in paper should be stored in secure file cabinets inside a locked office at approved sites. So you cannot be carrying people's information everywhere. So electronic data should be stored on a secure, approved institutional server and should not be transported using unencrypted device. So these are methods of ensuring confidentiality. Encryption, you can convert into unreadable codes. Access control, you can restrict access only to authorized personnel using methods such as passwords, multiple factor identification like the two-step identification. You can also anonymize your data where you remove characteristics such as name and replace them with other things that may not be easily identifiable by other people. So you can secure data storage at rest and also on transit. And then you can also minimize your data and collect and store only necessary data. So you don't need to collect all the information. Then of course you have to train your research assistants on how to safeguard this integrity. Yeah, so I think I'll stop there for this and just I've spent 17 minutes on this, and I'll stop sharing now and then share a new slide, which is going to focus on, I guess, what many of you are interested in hearing, which is how to approach the data analysis. So I'll quickly pick up that. If you have questions on this one, we'll take all the questions together. So just give me a second to find. Okay, yeah, can you see my new slide?
Yes, sir.
Hello? Okay, yes. Okay, so now I'm going to focus on the basic ways we can analyze our data, which is how do we write the data analysis section? How do we choose the statistical tool that is appropriate to answer our research question or objective? So, and that will be the consideration for this second part. I've given you an overview of the data management protocol. So if you can see my stuff, I'm going to be a little fast so we can finish. Just like in the first time, I have no conflicts of interest. This is commonly like a 4 weeks training, so I do not intend to say everything, but let me just try to reduce it to the next 45 minutes. Now, to provide a background, data analysis is an important part of your methodology. And all of you that are developing your proposal know that there is a data analysis section, which is almost the last part of your methodology. It is commonly the abattoir of doctors. That's many doctors are very skeptical about it. So people think it's difficult. But for those of us in mental health, we know that one of the things that perpetuates anxieties or phobia is avoidance. So if you think that rat is dangerous and you avoid it, you will not know how amiable rats are. So doctors tend to avoid it, so it becomes a problem. So but those who embrace it, they tend to know that this is not necessarily a very difficult task. So, but just to understand that your research, your analytic tools, the choice of data management, the choice of data analysis tool is guided by your research questions, your research objectives, or your hypothesis. This last thing I've just said is called the golden thread. The golden thread that binds all research work is your research question, objectives, or hypothesis, as the case may be. It is a research question or objective that gives us the title. Is that we guide the background or the introduction? Is that the methodology we answer? Is that the research we focus on? So your research question, objectives, or hypothesis is the thread that binds all your research work. So everything you're doing must be consistent, either to answer or to explain the research question that you have set out for yourself. Now, so before we move deep into it, it is good to look at the various variables that we can get from our research work. So we call them scales of measurement. And as I said, I will not teach you as a statistician, I'll just teach you as a colleague. So I'll reduce it a little to the way I have understood it myself. So I'm not going to be speaking statistical terms so much. I'm just going to explain it the way I understood it. So the first is nominal scale. I can call them categorical variables per se. Now, so these are variables that are, when I say that autonomous, they exist on their own and do not overlap. So things like gender, you have either a male or female in Nigeria. It is, even when you're recording it in SPSS, you can use numbers to do that, but that number does not imply a number. It just means that you have given this tag one. This one means male. So they are mutually exclusive. They are mutually exclusive. So that you cannot be in one and be in the other. That's what it means. So you can't be a male and also qualify to be a female. So that's why we say that there are nominal variables. So even when you see them as one or two in your SPSS, they are just a label for male and female. So in other words, when you want to describe them, you can only calculate their frequency, how many are there, and what percentage they constitute. So things like gender, things like your level of education or something, there is a primary or not, or no primary or secondary or tertiary or something. So you can actually say how many persons have no formal education and what percentage they constitute. That's some level of nominal variables or categorical variables. So in other words, these variables, you cannot calculate their mean or median. So you cannot calculate the mean of gender. You can only tell us what proportion of people are males and what proportion of people are females. Now, the ordinal scale, they have some resemblance to the nominal. They are also similar to the continuous variables, that's the interval and the ratio. Now, ordinal variables imply ranks. For example, social class. Your social class looks like it's either you're in class 1 or class 2 or class 3. That's okay. But the way they arrived at each of the classes is not just very simple. They use maternal education, paternal occupation and education, and all of them to give us the social economic class of the individual. So that's why we say it's an ordinal scale. Things like the questionnaire you have as agree, strongly agree, neutral, disagree, strongly disagree. They are all ordinal because if I ask you, how do you perceive Buhari's government? And I say agree, strongly agree, neutral, disagree, strongly, whatever. It means that there are so many factors you take into consideration to rank the person as either agree or strongly agree. So those variables are called ordinal variables. And they can be described using how many persons agreed. That's frequency and also percentages. But you can also describe them using a score. For instance, you can rate number 1, 1, 2, 3, and you can add it up. So, but whenever you're adding it up as a continuous variable, you must describe them using median and interquartile range, because by nature, they are not normally distributed. Ordinal scales, if you want to handle them as continuous, they are looked as a non-parametric variable in itself. They are not normally distributed. So you describe them using median and interquartile range, but you can also describe them using frequency and percentages. So in other words, they are in between the categorical and the next variable we're going to talk about, which is intervals or ratios. These are number-like. We just call it continuous variables. So there are some slight differences between the two with regards to having true zero and not having true zero. For instance, temperature of 0 means something, but weight of 0 means nothing. So, but in statistics, I just try to call them continuous variables. So it means that you can describe them using mean and standard deviation, or you can also describe them using median and interquartile range, depending on whether they are normally distributed or not. This person is disturbing me, so how do I deal with it? Can somebody do something about somebody's that is not muted? Can we mute the person?
I've muted the person, sir.
All right. Sorry. So okay. So just also to confirm that you have been hearing me all this while. Is that okay?
Yes.
Okay.
It's been clear.
That's fair enough. All right. So now let us see. So any variable you're going to generate in your data, whatever research you're doing that is quantitative, you're going to either get a nominal or categorical variable, ordinal, or a continuous variable, either an interval or ratio, where we handle them similarly. Now, so just let me delve into these are not my issues, but it is important that we know them before we go on to the data analysis system. So hypothesis is defined as the prediction about the possible outcome of your research. So it is not just a guess, but an informed guess from preliminary data, clinical observation. In other words, your hypothesis is always driven from previous experiences, from previous data, from previous research. And it is good to understand that there is a difference between the research hypothesis and then the statistical hypothesis. The null hypothesis or statistical hypothesis is how most of the softwares are designed, like your SPSS. It's already designed to null. Now, but your research hypothesis mustn't always be null. That's just the point we're trying to make. And not all studies requires hypothesis. So hypotheses are really best for experimental or quasi-experimental studies. However, you can also hypothesize for an association between two or more variables. Now, but you cannot hypothesize for only one variable. You cannot say your objective is to determine the prevalence of hypoglycemia among the people. You now come and hypothesize. There will be high level of hypoglycemia. That's nonsense because you are not connecting any two or more variables in terms of a relationship. But basically, really, where we need you to hypothesize is basically experimental research, at least quasi-experimental research. But of course, you can also use it in other places, especially when you're testing associations or relationship between two variables. So your research hypothesis predicts that there will, of course, be difference between two conditions. So, and this is called the alternate hypothesis. And this alternate hypothesis could be one or two-tailed. When it is one-tailed hypothesis, it makes prediction regarding both the presence of an effect and the direction of an effect. For example, if you say that the hypotensive effect of drug A is significantly better than drug B, you have already given the direction of the relationship and also not just the direction, you also gave the presence of the effect. So you told us that A is always going to be better than B. That's what you have told us. So this is a one-tailed hypothesis. But assuming that you say that there will be a difference between drug A and drug B, you have told us that there's going to be a difference, but you didn't tell us the direction of the difference. That's two-tailed hypothesis. So when you write in your data analysis section that your research is going to be two-tailed or your analysis is going to be two-tailed, what you are implying is basically the null hypothesis of the statistical analysis software, which already tend to have it as two-tailed. Most of the analysis we're going to do, chi-square, ANOVA, and the rest of them, we assume the two-tailed, except when you are doing a correlation in SPSS where they can make an assumption of one-tailed. Now, but if you have stated your hypothesis at two-tailed, the SPSS is fine because it's already a two-tailed. But if you have stated it as one-tailed, you will have to do something in your data analysis for your p-value, because the p-value you commonly get in your software are two-tailed. Now, but if my hypothesis is one-tailed, there is an implication from my p-value. So if I get the p-value of a in SPSS, which is already two-tailed, I'll divide it by 2 to be able to agree with my hypothesis, since I've stated my hypothesis as a one-tailed hypothesis. I don't know if I'm making any sense, but maybe I'll answer your questions when you have it. Okay, so that's about that. So I'll quickly get into the p-values, the inferential statistics before I now go to the specific data analysis pathway. So inferential statistics is when you're describing it goes beyond describing your data, like what percentage are males. It goes to test differences between variables. For instance, if you're interested in knowing if there is a difference between the reading ability of a male and a female, you see you're testing association. On one side, reading ability. On the second side, gender. So you want to see, is there a relationship, is there a difference between male and female with regards to reading ability? So in doing this, you are going to get a p-value, which is what they call probability value. The p-value always ranges from 0 to 1. The closer to 0, the more likely there will be a difference. The closer to 1, the less likely that there's going to be a significant difference. So in other words, what we normally do, there are 2 ways to handle your p-value. The first is to give a cutoff from your study, and this is what many of us do when we say that p-values will up or p will be considered significant when it is less than 0.05. That's what many of us do. So we set the criteria for which we will either accept or reject our hypothesis from the scratch. But you can also report your p-value and allow other people to interpret whatever they want, so that's the point. So either way is okay, but many of us do just give a cutoff value in our research. Now, but p-value do have a problem. So p-values alone do not permit you to make a direct statement about the direction of the difference. So if I do a chi-square and I found out that there's a difference between male and female with regards to their reading ability, it does not tell me whether it is male or female that have significantly higher ability to read. It just tells me that, well, with regards to gender, there are differences in reading ability. But are males more likely to read better than females? That will not be explained at that point in time. You will require to do other forms of analysis to be able to give the magnitude of the difference that you are reporting. So finding a significant p-value is a critical first step, but it doesn't always end there. There are other things to do, as we will see later in our analysis. Then also p-value also depends on your sample size. So those who have small difference in a large sample may have a significant difference. Whereas those who have large differences in a small sample may be insignificant. So in other words, your large sample with small differences may matter, but a small sample with large differences may not matter. That's what we call the type 1 and type 2 error. When you now fail to reject your null hypothesis, or when you accept your null, these are things that happen with sample size. Now, so based on these problems of p-value, it may be good to consider alternative explanatory statistical tools like confidence intervals. This may help us better because it tells us what the relationship is to the sample that it is drawn from. I'll quickly just leave this whole thing and go to how to choose the correct statistical measure. So how do we choose the correct tool? When do we use chi-square? When do we use ANOVA? When do we use all those things we hear? That's what we're going to do in the next 10 minutes or 15, so you can have your questions, because I have 1 hour to make this presentation. So this is the most important subject of our conversation. So because even if you don't know how to analyze your data, you should be able to look at your statistician and say, please, this is not correct. I do not think that you're using chi-square here is appropriate based on what I know. So please pay attention. You may not learn how to analyze the data yourself, but if you want to learn, that's a very good thing, and it's not quite difficult. But you should be able to know what is the appropriate statistical tool to use to handle your objective. That's what I'm going to spend the rest of 15 minutes to address. Now, before you choose the data analytic tool, there are several considerations to make. First is the type of data you have. That's the type of variable. Is it nominal or categorical? Is it continuous, that's interval or ratio, or is it ordinal? You must ask yourself that question. And if you read each of your objectives, it will be able to tell you what and what you have. Then, if you have a continuous data, you must ask yourself, is this data, this continuous variable, is it normally distributed or not? Remember, this is only for continuous variables, not for categorical. Then the third question is, what is my study design? Am I doing a cross-sectional one-off stuff? Am I doing a follow-up design where I check somebody at point 1 and point 2, the same individual? These things matter in the choice of your data analytic tool. And we're going to be using these considerations to select our data analysis section. So for the purpose of this lower level of statistical learning, that's for early career people, we're going to concentrate on 3 levels of analysis. The univariate analysis, which is where you're describing a single variable. For instance, if your objective is to determine the prevalence of hypoglycemia, that's obviously a univariate thing. So you're just trying to say, how many do I have with hypoglycemia over the total number of people in that study? That gives you the prevalence per se. Then it could also be bivalent level of analysis, where you're actually comparing relationship, association, or whatever, differences between 2 groups. Then it can be multivariate, where you have more than 2 variables being compared, if the text association, if there is any. So these are the 3 levels that will guide us. And majority of us, or many of us, we address these 3, or at least 2 or 1 of these in our data in each of our proposals. So let's start with the univariate. Okay, so let's start with the univariate analysis, which is basically summarizing your data, which is the very first level. So you want to summarize your data. You want to say how many persons, what is the mean, how many persons are between 20 to 30, what is our mean age, how many persons had the primary education, what is the median duration of school stay or something like that. That's basically description. We're trying to describe your data. What is the mean population? What is the mean birth weight? What is the median birth weight? That's what you're doing in your description. We call that univariate analysis. Now, if you have a continuous variable, for instance, you have a PCV, you have a birth weight as 2, 3, 4, 5, 6, you have a temperature, you have pulse rate, all these are continuous variables, they are number likes, right? So the first thing you do for this variable is to check, are they normally distributed or not, before you can choose your data descriptive tool. Now, to check for normality of distribution, if your sample size is greater than 200, it is preferable to use what they call Kamogrov-Smirnov test to test for normality of distribution. If your sample size is small, maybe less than 50, you can try using Shapiro-Wilk test. For those of you who are conversant with SPSS knows that these two results will be presented side by side when you check for normality. And then if your sample size is between 50 to 200, any of them is okay. But what I normally do is that if my sample is tilting towards 200, I consider Kamogrov appropriate. But if it is tilting towards 50, I consider Shapiro-Wilk as appropriate.
Very good with
So,
that analysis.
sorry, are you labeling this? Sorry, is there a problem?
There is no problem. It shows
Oh, okay,
interference.
that's okay. All right, that's okay. All right, so now, if you, well, for those of you who are conversant with this thing, what you just want to see is your p-value greater than or equal to 0.05. If it is, when you do this test, it means that data is normally distributed. But if it is not, if it is less than 0.05, it means that data is not normally distributed. And this will affect how you will describe it. It will affect how you will analyze it later in case you want to do association. Now, if your data is normally distributed, if you have checked and it's normally distributed, describe them using mean and standard deviation. But if you have checked and it's not normally distributed, please describe them using median and interquartile range. So if you see me reporting my age as the median age is 20 and the interquartile range is 2 points. So don't just say that anytime you have age, it must be median. That's not correct. It means that the individual has subjected the age to normality tests, and it showed them that this age is not normally distributed. So I expect the person to describe the age with median and interquartile range. But if you find your own to be normally distributed, go ahead and describe it with mean and standard deviation. So that's just the point I want to raise here. So don't be so stuck by saying it must, they say I didn't give mean age. That's not correct. If you describe median, it means that your data is not normally distributed. So, and it's okay. Median becomes the best measure of central tendency when your data is not normally distributed. Why interquartile range becomes a better one for the variance. The same thing with mean. Mean is the best to use when your data, of course, when your data is normally distributed, it means that the mean, median, and mode are the same. So if your mean is 20, if your data is normally distributed, the mean is 20, the median is 20, the mode is also 20. That's the qualities of a Gaussian data. That's the quality of a normally distributed data, you know. So, but when the data is skewed, then median becomes the the most appropriate measure of central tendency to use to handle your data at that point in time. Now, assuming we want to describe a categorical variable, I'm done with continuous. If I want to describe categorical variable, that's nominal data, gender, level of education, or prevalence of something in my work, you describe this using the frequency count, which means how many persons are males and what percentage they constitute in the population. You know, yeah. So for those of you who may have like to determine the prevalence of something, well, it is a good practice that when you calculate your prevalence by saying the total number of people with that disease over the total number of people studied, it's also good to calculate the confidence interval and report it. For example, if my first objective is to determine the prevalence of otitis media among malnourished children attending CHOP, and I reported this, the prevalence is 20, it is not just a good practice to leave it at that. you are supposed to calculate the confidence interval of that prevalence because it tells us the range of which the otitis media is among children that are malnourished going to the CHOP. So if you just report 20%, you'll be struggling to say, oh, most of you that are in pediatrics that want to say, my study is 20%. Others have found 17. Others have found 23. So my work is different from them. That's not necessarily true. If you have reported your confidence interval, it will tell you the range of which this prevalence lies in that population. And you can see that this range ranges from 18.5 to 24.3. See how I reported it. It's not better. It's better reported this way, not with hyphen. Use a comma. This is the standard way from the APA scale. So if you report this, it tells us that your point prevalence you got is actually 20. But this prevalence actually ranges from 18.5 to 24.3. So anybody that have found anything from 18.5 to 24.3 is also within your range of what you have found. That's just for that. So that's it for describing data. So I may not have time for the practical sections. So I just continue. And then those of you who can make it for the physical meeting will demonstrate it. So let's go to bivariate analysis. Now, when I now want to check differences between two variables, compare two variables, test associations or relationship between two variables. This is what we are talking about. So especially in a cross-sectional study. So I'm going to be picking up some common scenario that we encounter in biomedical research. Now, the very first of it is when you want to compare two categorical variables. For instance, you want to see the relationship between, you want to compare the side effect profile with regards to vomiting, like vomiting status, whether somebody vomited or not, between people who received fentanyl, like an anesthetic. He wants to check, he has two groups. One received fentanyl and the other received maybe pentazocine or something. So, and then he wants to compare the risk of vomiting or the prevalence of vomiting in the two groups. So he recorded vomiting present or absent. And then he has two groups, which is those with fentanyl and those with pentazocine. So this is two categorical variables. On one side is vomiting status, categorized as present or absent. On the other side is research group, categorized as the pentazocine group and the fentanyl group. So this is two categorical variables being compared. At this point, it's appropriate to use chi-square test. Now, irrespective of the number of categories, for example, I want to check the relationship between gender and educational status. On one side is gender. Gender is categorized into male and female. Then the other side is educational status, which is also categorized into no formal, primary or secondary or tertiary, whatever. And the number of categories in the education is 4, and that of gender or sex is 2. So irrespective of the number of categories, chi-square is still the test to use. Now, there are some special considerations when you're doing categorical versus categorical. And especially when you have a 2x2 table. For instance, the vomiting status that is present and absent, and then the research group that is fentanyl and pentazocine is actually a 2x2 table. So if the SPSS flags off that you have a particular number of cells that expected count less than 5, it means that the assumption of Pearson's chi-square, which is the commonly reported, is not met. So you may consider some form of corrections, and it comes in two ways. It's either you pick the Fisher's correction as Fisher's exact text, or you do what they call Yates corrected chi-square. This is evident for a 2x2 table. But for a non-2x2 table, yes, correction is not attainable, but Fisher's is still attainable in non-2x2 table. So that is about that. Now, when you make comparisons in a chi-square, it does not give you the strength of association directly, but there are things you can do in that chi-square table and it will give you some level of strength of association. And that is when you click on the In SPS, if you click on what they call fill and grammar, that's coefficients. For 2 by 2 table fill, for non 2 by 2 table grammar, whatever value it gives you can tell you what quantity of the dependent variable is explained by the independent variable. I'll come to that, maybe in a practical class, I should be able to demonstrate that for you. So these two tests are useful in quantifying association, and they are less likely to be affected by sample size. Chi-square value is affected by sample size, but if you quantify using the field or grammar, they tend to be less sensitive to sample size discussion. So, for example, we have 80 young girls. 80 young girls completed an eating questionnaire, which allowed them to be classified as either high or low anorexia nervosa. In addition, the questionnaire asks for the girls' mother's employment status, which are classified as full-time, part-time, and unemployed. And also, there is a third variable, which is their cultural background, classified as Caucasians and non-Caucasians. And also the type of school they attended, private or public. Assuming that your first objective is to determine the association between anorexia nervosa status and participant social school variable, in this case, race and school type. Now, I want to determine this association between anorexia status and type of school. Now, can you unmute your mic and tell me if you have an objective to determine the association between the anorexia nervosa status and participants' school type, what statistical tool will you consider in your analysis, and why? Can somebody unmute and tell me so we can move on? I'm just on the set. So what statistical tool will you use?
Okay, good evening, sir.
Yeah, good evening. Go on, please.
Okay, I think I'll use chi-square.
Okay.
Because the school is categorical, that is private or public.
Yes.
And then the anorexia status is also high or low. Is exclusive. It's either is high or is low.
I agree perfectly. Just say hang on. So are there other options that is available? Assuming that the number of people with anorexia nervosa is small. For example, we have like 8 persons with 4 persons with high, and then 3 with low. And then we have school type, we have like 8 persons in private, 4 persons in distance. So what other options do you think you can consider here when you have a small sample size?
Did you hear me? I said features the exact test.
Hello? Hello?
I think there is poor network. I think he has been logged out. So just wait for him to join us.
Okay, so I muted myself. Sorry. I muted myself. Can you hear me now?
Yes, sir.
Okay, that's okay. So thank you very much. You are quite correct, actually. So that's what you should consider. Okay, so assuming that I've got my result, we get the frequency counts and percentages for each, like those with anorexia nervosa high and those with private. As in, you get to have those cross tabulations. So you're going to get the frequency and the count and the percentages. You're also going to get the chi-square value and you're going to get the p-value. So how do I report it? So I can say that the relationship or the association between the tendency towards anorexia or the anorexia status and the type of school attended was significant. So I open my brackets, put the chi-square value, and also pick the p-value. Now, if you have gone further to do the phi coefficient, you can also add that the association was of moderate strength. Moderate is because of the phi coefficient. Any phi coefficient less than 0.3 is weak. Between 0.3 to 0.6 is moderate. Above 0.6 is strong. So if you have clicked in the chi-square, the phi coefficient, you can actually quantify what degree of the anorexia status is explained by the type of school that attended. Assuming that you're saying that the anorexia nervosa status is a dependent variable, it depends on the type of school you're attending, whether it's private or public. So the independent variable is now school type, right? So you can say that the association between the anorexia status and the school type was of moderate strength. And the type of school accounted for about 59. You just convert this phi coefficient to a percentage, which is 59.4, accounted for 59% of the variance of the differences of the variance in the score or of the anorexia status. So that's basically how to put it. It's not just this way, but you can find a way that suits you. But this is just one of the ways you can present your findings later. Can you just give me a second? Let me sort out some. No, yeah. Okay, so sorry, I'm at home, so there'll be some domestic disturbances occasionally. Okay, so this is just one of the ways you can put up your result. There is no one way, but the most critical ingredient is always good to put up your chi-square value and your p-value at the end of it. You can also put the percentage that had mild or that have high anorexia that are in private. It just depends on how it appeals to you, that you can now make your presentation in that regard. All right, so we continue with the next scenario, which is when you're comparing continuous variables against categorical variables. Now, on one hand, you have a continuous variable, and on the other hand, you have categorical. So especially those of you who have two groups, you have cases and control. There are people with asthma and those with healthy people. That's two groups. And then you want to compare the PCV of the participants between those with asthma and those without. So that's example of this scenario. So now the fundamental question is to ask yourself, what is the normality of distribution of the continuous variable? That's the PCV. And then how many categories are there for the categorical variable, which is the research group? And we have in this case two, those with asthma and those without asthma. Sometimes you may have those with asthma. You may have people who are drug naive, drug exposed and control. Or for those of them in pediatrics, you have those with sickle cell in crisis, in steady state, and people without sickle cell. That's three groups. This is not two. So you want to ask yourself, the categorical variable, is it two or more than two? Then the continuous variable, is it normally distributed or not? Can you still hear me?
Yes, sir.
Yeah.
Okay, yeah. Okay, so now once you have established this in your variable, you can now make a choice of what to use. So assuming that based on this, how many combinations do you think we can have? Who can guess how many combinations can be normally distributed or not? Two categories or more. So we have how many possible scenarios? Four. We have actually four possible scenarios. So we may have a normally distributed continuous variable with two categories. In this case, it is good to use independent t-tests, or what we call student t-test, or just t-test. They are all the same thing. So that's what you use at that point. If you have a normally distributed, assuming the PCV is normally distributed, and we have asthma and healthy control, and we compare the PCV between the two groups using independent t-tests. That's how I will write it. But of course, in your proposal, you do not know whether your continuous variable is going to be normally distributed or not. So that's why it's good to speculate there that the comparison of the PCV between the cases and the control will be determined using independent t-test or Mann-Whitney test as appropriate. That's how I expect you to write it in proposal, because it's only when you get the data you know whether it is normally distributed or not. But if it is not normally distributed and also the same category, that's when you use the non-parametric equivalent of t-test, which is Mann-Whitney test. I've done 2 now. So I'll now go to where we have continuous variable that is normally distributed and more than 2 categories. That's 3 or more categories. For instance, I want to compare the weight now as in kg across different socioeconomic and different educational status. I have no formal, primary, secondary, and tertiary, 4 groups. So I can no longer do independent t-test or Mann-Whitney. I can only consider ANOVA or Kruskal-Wallis test. And what will determine whether it is ANOVA is what is the normality of distribution of the weight. If the weight is normally distributed, I will use analysis of variance, ANOVA. But if the weight is not normally distributed, I will consider using Kruskal-Wallis test. Now, this is not the end. It is simple for independent t-test and Mann-Whitney because it is easier for you to know which one have significantly higher PCV. So I can quickly look at the mean or the median in the asthma group and then in the healthy group. Maybe assuming that the asthma group is 20%, and then the mean in the healthy population is 40. I can quickly say that the PCV and the p-value is less than 0.05. I can say that that the mean PCV between the people with asthma and those were 20 and 40 respectively. And this difference was significant, or I can say that the PCV was significantly higher in the control group when compared to people with asthma. It's easier for me to say that because I can take a look at the 2 and say which one is higher. Now, but if you record a significant p-value for or Kruskal-Wallis test, it's difficult for you to know whether it is between people in steady state and those in crisis, or is it between those in crisis and the people with normal healthy control group, right? So in other words, when you have ANOVA or Kruskal-Wallis test and the p-value is significant, it is important to do a further test we call post hoc analysis or post hoc test. That post hoc test, we now compare them. We compare sickle cell crisis and steady state, crisis and the healthy people, steady state and crisis, steady state, and then give you their p-values. That's what you do for you to be able to say where the significance lay in this regard. Okay, so I think that should be all for there. I don't know if there is any question here before I don't know whether we still have time. So moderator, do we still have time to continue or should I end it here? I still have more to do.
Okay, so Chief.
So moderator, are we this 1 hour? Are we ending here or are we continuing?
Dr. Gloria.
I think we can go ahead, Chief, please. What's
Okay.
important to understand this here, so we don't just break it.
Okay, that's okay. So let me now rush a little more. Yeah, so I've given you this. So let's get to the next assumption. Okay, so let's look at this. So your study objective is to compare the PCV of participants admitted for Lassa fever with those of COVID-19 infection at isolation center. So let me ask, somebody should unmute yourself. What are the variables being tested here? You have to tell me which variable, because that's what determines what are the 2 variables I want to compare here. So tell me first, before we now choose to know, are these variables continuous or categorical or something? So it helps us to know which test to choose. So who can unmute and answer the question? What variables are we testing for in this objective? please stop now.
Okay. Hello. Hello, can I be heard?
I
Yes,
can hear
yes.
you. I can hear you. Yeah.
We can
Okay,
hear you.
okay. I think the variables here are the PCV, which is a continuous variable, and then the infection with Lassa fever and COVID-19.
Okay, please go on. Sorry, I can hear you now. Go on, please. Go on.
Okay, I said, I think we have two categories of variables here. The
Okay,
PCV,
okay. So is
which is a
PCV continuous or categorical?
is a continuous variable here.
Okay.
While
Can you make PCV to be categorical?
Yes. If
Yes.
if we
I'm not sure.
if we grade
Yeah, we
married
can.
mothers,
We can. We can. If we decide to say PCV less than 30 is anemia, and those above 30 is normal, you have converted this PCV from being a continuous variable to becoming a categorical. And at that point in time, your analysis will change. But in this case, our PCV is still 40%, 20%, 30%. So we are taking it as a continuous variable. So continue with the other variable. Yeah.
Okay, the infection with either Lassa fever or COVID-19, that is
So
the
that's it.
categorical.
Good. So we have two groups here. One is Lassa fever and the other one is category. So now, what are the options? If you are now to write your data analysis section here, you don't want to consult a statistician, how would you write, you handle this objective if it's your study? Tell me.
Okay, because we have a continuous variable here and a categorical, then I will subject the T. Okay, I would say I will analyze the PCV as a continuous variable. I will analyze it. I'll subject it to a normality, yes, to a normality testing. And
Okay.
so depending on the results, if it's normally distributed, then I'll use chi-square.
Do we accept chi-square?
No, is it chi-square? No, yes.
No, we don't accept chi-square. So
Duty. Sorry, I'm confused here now.
so you're not
I know
confused. Just it will take time to sync. You'll get the stuff. So, but you're not confused. But you're doing well already. So you're now comparing PCV across two groups. So PCV is now normally distributed. So what will you use to test it? Continuous variable versus two categories.
You use student t-test.
Yes, I agree with you. So, but assuming that the PCV is not normally distributed, what would you use?
You now use somebody with need test.
Man with new test. You're correct. Thank you.
Yeah,
Thank you so much. That somebody may be Abdullahi. So, but it's just man with the new test. So thank you for grabbing it. So if I'm writing it at the proposal level, I will write that the comparison of PCV between those with Lassa fever and those with COVID-19 infection will be done using independent t-test or man with new test as appropriate, because I do not know what my PCV will look like. But had it been I have finished the work, I will no longer speculate because I've tested the normality of my PCV. I'll just say that the differences in PCV between the two groups were compared using independent t-tests. I don't know if that's understood. Is that understood?
Yes, sir. Yes, sir.
Okay, yeah, so we can now move on. So you can see other names of independent t-tests. So anyone you see is still the same. That's still the same independent t-tests. In case you see it anywhere, they are not different. Hold on. I'm teaching something. Okay. All right. So we move on. Now let us I cannot do these practical things though, but I hope I'm able to get those in Enugu so we can do it in SPSS, at least the one we commonly use. Now, but beyond, t-test provides us with the opportunity to calculate the effect size. And I'll be teaching you how to do the effect size, because effect size talks about clinical utility. because your p-value tells us about statistical significance. Some things may not be significant statistically, but they may be clinically useful. So statistical significance does not translate to clinical utility. Sometimes your finding may not be statistically significant, but it may be clinically useful. So it's for you to recognize that pattern of data and be able to use them. So just know that you can calculate effect size from an independent t-test, and you can interpret the effect size using the coherence rule. Is that okay? So those who will be there in the practical section, I'll be able to teach you that. Okay, so I'll go on with, I'll not demonstrate these ones, so I'll just continue, then hopefully I'm able to. So now see how to report it. The mean PCV between between Lassa fever and COVID-19 patients were 20.3% and 17.5% respectively. The difference in mean, or the mean difference between the two disease states, or between the PCV of the two disease states, was significant, statistically significant. Once you do that, you put the T score, put the p-value. Then the magnitude of the difference, that is the mean difference, you put it, that's 20.3 minus 17.5, that's the mean difference. And then you report the 95% confidence interval of that mean difference. When you say it's of large effect, it is about the effect size, which is 1.1. So, but most of you may not do all, but at least you should learn how to report your effects and your independent t-test for Mann-Whitney. Okay, so don't mind the gaps in my talks. I have people here who are distracting me. So, but hopefully I'm able to do things. So we'll practice when we meet. Then let us go to, now this I have done is for independent sample, like a cross-sectional study. All I have described now is for a cross-sectional study. But let us look at when we have bivariate analysis for a follow-up design, like when you have pre-post or longitudinal design. Remember what we talked about: independent t-test, Mann-Whitney, ANOVA, Kruskal-Wallis test, chi-square. They are all for basically cross-sectional design or independent samples. Now, assuming a researcher is supposed to do an intervention or not, he measures the weight of children at day 1, and then gives these children a particular diet, maybe Hermes, for pediatricians, if it is still currently used. Okay, I had that one in medical school. So then after 3 weeks of giving this individual, he also measured their weight after. That's pre-post design. There is a pre and there is an intervention, there is a post. Remember, these individuals are the same. They are not independent. It's the same number, the same child A that was measured at point A. It's also the same child measured at point B. So that is paired sample. You can have one interval of measurement, which is just pre and post. You can have multiple intervals. You can measure baseline 3 weeks after feeding them, and then 4 weeks after. This is called follow-up design. They are paired samples. So in other words, these individuals are the same, but they are measured at intervals of follow-up. So if you have continuous variables, is your variable here, like weight, baseline weight, 1 week weight, 12-month weight, So if weight is the 10 and the weight is continuous, you still have to check for normality of distribution. And then you still ask yourself, did I measure this weight twice or more than one or more than twice? That's 3 or more times. If it is normally distributed continuous variable, and you measured only at 2 intervals, please use what we call paired t-test to analyze it. But assuming that the weight is not normally distributed and it is still the same 2 times of measurement, use what we call reconnaissance rank tests. But if you measured more than 2 times, like 3 or more times, and it is normally distributed, use repeated measures ANOVA. Repeated measures ANOVA is not ANOVA. ANOVA is for the independent sample. But repeated measures ANOVA is for paired sample that you measured more than 2 intervals. Then, if it is not normally distributed and it is more than 2 intervals, that's 3 or more, use what you call Friedman's test. Is that clear in our heads?
Yeah.
Also, Diego. Okay, so let me now say, assuming that a pediatrician wanted to see the differences in PCV after transfusion, and he measured the baseline PCV and got 20, and then post-transfusion he got 40, and he wants to compare, is there a difference in the PCV? Is there a significant difference in PCV after transfusion? And our PCV is normally distributed. The same person was measured, given baseline, and he was given blood, and after he was measured after. What test will you do, assuming that the PCV base and after is normally distributed? What test will you do?
Wait, stop lying. Come back to yourself.
Paired t-test.
Paired t-test, my brother. So, but assuming that this PCV was not normally distributed, what test will you now do?
Wilcoxon rank test.
Okay, yes. Assuming that this pediatrician measured baseline 1 hour post-transfusion, 4 hours post-transfusion, and he wants to compare are there differences across the intervals of measurement. If this PCV is normally distributed, what is the choice statistics he should use?
No, I know.
Repeated measures ANOVA.
Assuming it's not normally distributed, what will he use?
Friedrich.
Okay, thank you. Some people have understood me, so I'm happy. So I can continue. That's correct. You guys are correct. So I'm just trying to bring it to our everyday life. But assuming that this is not continuous variable, we have a surgeon decided to classify a tumor as inoperable and operable. And then he now gave neoadjuvant chemotherapy to debunk the tumor. And after giving the neoadjuvant chemotherapy, some of the tumors that were previously not operable some of the tumors that were previously inoperable became operable. So at the beginning, he has operable and inoperable. Then the same individuals were given neoadjuvant chemotherapy, and at the end, he still classified them as operable and inoperable. So he now wants to see, is there a difference in the proportion of tumors that became operable after neoadjuvant chemotherapy? In this case, you use what you call McNema test because you're comparing proportion across 2 intervals. That is the same person measured point A and point B, the same sample. If it was independent sample, we would have done chi-square. But this is same sample. The same individual was classified as operable and inoperable, but he was just given an intervention that reduced some people from the tumor from being inoperable to operable. And he now wants to see, is there a difference in the 2 baseline and after? You do McNema test. I do not have any statistical tool for more than 2 intervals or more than 2 categories. I do not know for any in this regard for paired sample. All right, there could be, but I don't know. All right, so if we have understood ourselves, we will now end the bivariate analysis by looking at when you now have continuous versus continuous. Remember, we have done continuous versus categorical for cross-sectional study, where we say independent t-test, Mann-Whitney, ANOVA, and Kuskar-Wallis test, depending on what we have. We have categorical versus categorical for cross-sectional, which is chi-square. We have continuous at different intervals, 2 intervals, paired t-test or Wisconsin's, paired sample for more than 2 intervals, repeated measure ANOVA and the Friedman's. And then paired for categorical, 2 categories, 2 intervals, McNema. Now we want to look at when we want to compare continuous versus continuous for a cross-sectional design, not paired now. This is, we want to see, is there a relationship between 2 independent samples? Is there a relationship between weight and height in children? Is there a relationship between dosage of medication and the and is there a difference between is there a relationship between dosage of analgesia and time for analgesic request or something? Just two continuous variables, being compared but not paired now. Now, when you have two continuous variables being considered, you want to test the relationship or association. You will use Pearson's correlation if your data is normally distributed. But if your data is not normally distributed or you're comparing a continuous variable against an ordinal variable, you will use Spearman's correlation. So that's about that. So relationship between weight and height, Pearson's if both of them are normally distributed. But if they are not normally distributed, Spearman's. But assuming you want to look at the relationship between weight and then maybe social class. Social class is also ordinal. You could also use Spearman's, if you want to handle the social class as an ordinal variable and you want to take it this way, you can also do that. You can also compare it using either what's called Kuster-Wallis test, because it is also for a non-parametric test. Okay, so finally, we will just take a look at the multivariate analysis. I'll end it here. And don't hesitate to ask me other questions based on your own proposal, if you have your proposal or you're already doing your work. Now, the multivariate analysis helps us to quantify association. They also help us to control for confounding variables. So if you have a relationship that you think there is a third factor that could be adjusted for, you can use multivariate analysis to do that. I don't know who can tell me how can you control for confounding variable in a research work? Can anybody tell me the various levels you can control for confounding variables? Can anybody try?
Independent variable.
No, I say, what are I'm looking at, I just want to sample your opinion on how can you control for confounders, covariates, confounding variables in your research work? What are the methods of trying to address confounding variables in your research work?
Good evening, sir. I think we can control variables by matching participants.
Correct. Thank you so much. So at the design phase, you can do by matching. That's one. So what else?
You can stratify them like by age, disease, severity.
Thank you so much. By stratification. What other way?
Regression analysis.
Yes. So in other words, you can do at the design phase. So when you do matching, when you stratify, when you do eligibility criteria, when you do some exclusion criteria, you're actually trying to control for confounding variables too. And then finally, there are times you cannot control for all factors. So we encourage you to measure those factors and then use regression analysis to control for them. So multivariate analysis will help you to control for confounding variables in some research work when you cannot do the control at these levels that our sister had mentioned. Okay, so now when you want to quantify or control, you must have to ask yourself, which is your dependent variable? So if your dependent variable for that test you want to do is categorical, use logistic regression analysis. If you have two categories, for instance, operable and inoperable is two, or gender, male and female, as your dependent variable, you use binary logistic regression. But if you have more than two categories, you use multinomial logistic regression. These are not the only regression. There are other regression analysis, but I just use what we use commonly. Then if your dependent variable is continuous, for instance, you want to look at the predictors of liver enzymes. The liver enzymes are your dependent variable. Yeah, for instance, AST, ALT, these are continuous variables. So if you want to look at factors that predict their level, you should use linear regression analysis. I don't know if that's okay. Now, let us look at the other type of research. Some people increasingly, especially those in internal medicine, they tend to give us new instruments, and also some people in pediatrics. So some people may want to evaluate whether a new test is good in detecting a particular thing. For instance, those in gastroenterology may want to look at whether APGAS, is that APRE score, whether it can predict liver fibrosis. Now, APRE score is some variables that come together that you score them, and a certain score we think can predict liver fibrosis. So, for example, somebody wants to look at the validity of APRE score in determining whether there is liver fibrosis. In other words, it's going to take people with liver disease, measure the get APRE score for each person, and also do a biopsy. You always will take a gold standard in that your kind of research, and your gold standard may be biopsy. So biopsy will categorize people as having fibrosis or not. But you now want to see, can you get a cutoff from your APRE score that is sensitive enough to predict to predict the fibrosis as already determined by the gold standard. Now, this type of test, this type of research is a kind of a diagnostic study. So in this case, you will be trying to get the sensitivity, the specificity, the positive predictive validity, and the negative predictive of APRE score in determining liver fibrosis. So there are two ways to do that. If your APRE score is a score and is continuous, it is better to use what we call receiver operating characteristics curve to check the diagnostic utility of APRE score against the gold standard, which is liver biopsy. So you will get each of the individuals, measure them, and classify them as having fibrosis or not. Still measure their APRE score. Then use the ROC curve. The ROC curve will give you what they call area under the curve. And area under the curve tells you whether this test is a good test. If you have seen the ROC curve, you find out that you have a reference line, and you now have the test line. If it is hugging the vertical, the vertical, the one that is standing up, is it the S or Y? Which is standing?
It's Y.
Y. So if it is going to hug the Y axis, it's going to be a perfect test, because the area under the curve will be above 0.7. So once your area under the curve is above 0.7, it's an acceptable, or it's approaching 1, it is almost a perfect test, right? If it's approaching 0, it is not a very good test. So the closer it is to 1, the better that test is. Then from there, you can calculate the sensitivity, specificity, PPV, and MPV. Now, but assuming that you have 2 tests. One, you want to use something like cystatin C to check if somebody, urinary cystatin C, to check if somebody have what do you call it again? An infection. And then you also do a blood culture. Blood culture is your gold standard, but also your cystatin C may also classify somebody as having UTI or not UTI or something. I just can't remember. But the most important thing is that you have a test that can classify somebody as yes or no, and then a gold standard that can classify somebody as yes or no. Now, when you have that kind of scenario, you will cross-tabulate them. You do what looks like chi-square test. Just do cross-tabulation. You will be able to pick your true positive, which is when your new test picked it as correct, as present, and then the culture also picked it as present. That's true positive. Then you will have a situation where the test picked it as positive, but the gold standard picked it as negative. That's false positive. Then you will see a situation where the test picked it as negative and the gold standard picked it as negative. That's true negative. Then you will see false negative, where the test picked it as maybe positive and put it as negative, but the gold standard picked it as positive. That's false negative. You can now use the formula for sensitivity and then substitute it to calculate your sensitivity specificity PPV and MPV. So either way, if you have a linear test, ROC call, if you have categorical, cross-tabulate, get TN, TP, FN, and FP, and calculate using the appropriate formula. Now, but if you want to do the degree of agreement between two raters, for instance, a surgeon wants to check what is the degree of agreement between ultrasound and the post-op findings for acute abdomen. So this individual will do an ultrasound and say, oh, there is abscess or no abscess. There is appendicitis or no appendicitis. Then he will wait for the surgeons to now check. And then the surgeon will now go to theater and say, oh, there is appendicitis or there is no appendicitis. If you want to check the level of agreement between these two raters, that's the ultrasound rater and then the surgeon rating intra-op. That is what we call kappa statistics. But in this case, you'll be reporting what we call the Cronbach alpha, which is for categorical variable. But assuming that the variable of interest is something like blood pressure, somebody uses aneroid fig to measure blood pressure and gets the diastolic to be 20. Another person uses another method to measure and it is 30, and they want to check the degree of agreement between these two instruments. But what they are measuring is continuous. That's when you also do kappa, but what you report is intra-class correlation coefficient, ICC, as against Cronbach if it was categorical. Now that's for about that. Then finally, I want to also tell us about estimating time for event. So you are following up people and you're looking for time for an event. So you want to see what is the time it takes for somebody to die in cancer research. What's the time it takes somebody to survive if he's giving chemotherapy? What time does it take for somebody to be lost to follow up in HIV clinic? So it's a follow-up design. Now, but you're looking for an event. This event can be recovery, it can be response to treatment, it can be death, it can be anything. You define what your event is. If your study is that way, you do what we call survivor analysis. There are different forms of it. There is the common one, which is Kaplan-Meier. Now, but there are also the cost proportional hazard, but I will not bore you, but just know that you're doing something on survivor analysis skill, you know. Then factor analysis is used for data reduction or scale reduction. I developed a questionnaire and I want to see whether this questionnaire measures different components. Now I put my questionnaire in factor analysis and it will tell me, oh, I have 10 questions addressing domain of avoidance, 20 questions addressing domain of competence, and all that and all that. So, brethren, this is where I end our conversation. So this is a sample of how you can write your data analysis section. So yeah, you can say analysis of the results will be done. This is for proposer. If it is, if you have done the work, you say was done.
What are you eating?
Yeah, so analysis of results will be analyzed or will be done using the international whatever package, whatever version you want to use. Data will be coded into the software. Thereafter, it will be scrutinized for incorrectly filled information and cleaned. And following the step, then the normality of distribution of continuous variable will be done using any of these tests, depending on the sample size. Thereafter, the results will be displayed in figures, frequencies, and tables as appropriate. Continuous variables will be described using mean and standard deviation or median and interquartile range as appropriate, because we don't know whether they will be normally distributed or not. While categorical variables will be described using frequency count and percentages. Then you will take each of your objectives and handle them. So assuming I have this objective, so can somebody now try? So this person wants to describe the social demographic and obstetric characteristics of women who had CS in the study setting. So this is basically descriptives. So age group will be described using frequency counts and percentages, level of education the same, social class the same. Gravidity can be classified as primary gravida and multi and grand multi-parity or whatever. Parity, you can also choose to classify them however you want to do it. You describe them, if you categorize them, you describe them using frequency and percentages. Then he wants to compare the duration of analgesia. Duration is time, so it's number between those in the dexamethasone group and ondansetron group. So because duration of analgesia is a number, it can be 10 hours, 20 hours, 30 hours, you will said that comparison of duration of analgesia between the dexamethasone and the ondansetron group will be done using independent t-test or Mann-Whitney U-test as appropriate. If the duration eventually turns out to be normally distributed, then we use independent t-test. But if it turns out not to be, we use Mann-Whitney. That's how to write in a proposal. But if I have done this work, I'll tell them that the comparison of the duration of analgesia between the two groups was done using independent t-test or using Mann-Whitney, depending on what I used. So thank you so much for your time, and I think you can now ask your questions if there are any.
Thank you so much, Chief.
So your questions, comments, corrections, confusions, but always sort it out.
So, Dr. Nebo, you can unmute yourself.
Okay. Good evening.
Yeah, good evening. Go on. I can't hear you if you're talking. Unmute yourself and talk.
Sorry, it's like someone muted me. Sorry. Thank you so much, sir, for this lecture. It's well appreciated. Okay, so I just want to ask two questions. First, to clarify on when you were talking about the use of the chi-square and the Fisher's test in terms of the categorical variables, where you have samples, if your sample size is larger or is smaller, it's not really clear, sir, for me. Then secondly, sir, I wanted to find out when you're in like a correlation, when using either the Spearmans or the Pearsons, like, okay, let me just give an example. So in my study, I had both, it's a study on biomarkers, and I had some which were normally distributed and some others which were not normally distributed. But in terms of when I was trying to correlate it, I decided to use the Spearmans, because the Spearmans is for the non-normally, that's the one that is not normally distributed. So I want to know, sir, whether that's the correct thing for me to do. Or
yeah, that's very correct. So when you have when you have one normally distributed and the other not, please take preference to non-parametric. In fact, when you are in doubt about the normality of test distribution, use non-parametric, because nature is not normally distributed. As in, if you come to a hospital setting, most of the data you get there are not normally distributed. For instance, weight in the pediatrics ward, you get a child that is weighing 0.5 kg, and then you get another one that is grossly obese. So nature is not normally distributed. Where you commonly get normally distributed variables are within the community. But in a hospital sample, it's so very, very difficult. Somebody may have PCV of 0.3, of 5. Why another person is having polycythemia of, so when you check their PCV, you find out that it's skewed. So it is always preferable to use non-parametric when you're even in doubt of the normality of distribution. But our people are always interested in t-test and all that. As if to say nature is normally distributed. Nature is not. So I would prefer that you use your not Spearman, which you use. It's better off to use that at that point in time. So can you see this data I have here? So let me use it to demonstrate to you the when to choose Fishers and all that. Can you see this data?
Sir. Yes, I can see it.
Okay, so I'm going to do some analysis here now and then show you something. Now, this person is an anesthetics. So I'm going to do cross-tabulation, which is chi-square test. So the study groups, I think there are 2 here. I guess there are 2. So I'll put it in the column. So I want to see if there are differences in vomiting. Let me see. Let me see if I can get something that I use. Okay, so I want to compare post-operative hypotension. Hypotension is classified as present, or, okay, let me say post-operative pruritus between the 2 groups, right? So I'll come here and click on my chi-square. If I want to click on the fill and grammar, I'll do that. I'll say continue. I want to check the percentage in volume in the column, and then continue, and then say, okay. Now, can you see my output?
Yes, sir, I can see your output.
Okay, so you can see there are two groups here, people that receive bupivacaine plus clonidine, and people that receive bupivacaine plus fentanyl. Now we want to compare post-operative pruritus. Of course, it made the assumption of a chi-square, right? Two categorical variables. Trial group categorized into bupivacaine plus clonidine group and bupivacaine plus fentanyl group. Then we have post-operative pruritus, which is either present or absent. Now let us see. So you can see that among the bupivacaine group, 0% had pruritus, while 57.1 for the fentanyl had. So, and we can see the first thing here is Pearson's correlation, right? Now, after Pearson's, the next thing is, are you seeing the, let me see if I can convert my cursor to, okay. Now, you can see the third table. The first one should have been the default one to be reported, which is the Pearson's chi-square. And then the value here is 23, and the p-value is for two-sided, which is significant, 0.00001. You know, that's less than 0.00. It's significant. Now,
sir,
yes.
Sir, I don't know whether I can see it. We can't see the table. I can't see the table.
Okay, you're not seeing the output. Okay, wait.
No.
Okay, sorry. Let me just stop sharing the other one, and then just give me a second. Stop sharing. So let me share the output. Okay, can you now see the output?
Yeah.
Can you see the output now?
Yes, I can now, sir.
Okay, now so you can see we have compared two groups now. On the column, we have the bupivacaine clonidine group, and then bupivacaine fentanyl group. On the row, we have pruritus, whether it is present or absent. Is that okay? Now,
yes, sir.
This gives us the descriptives. What percentage of people with clonidine that receive clonidine had pruritus? What percentage? 0. How many are there?
Yes.
0. Right? So the 0 here is the count. Why the percentage is percentage? So the SPSS is talking about the count. So the 0 is the count. So what is the count in the bupivacaine fentanyl group? What's the count there?
16.
16. So, and the percentage is 57.1. Now, let us see what the SPSS did. Now, this is the observed value. So, what we're interested is in the expected count, not the observed. So, your SPSS will tell you, look at the chi-square test down. You can see the very first test there is Pearson's chi-square, which is the default to be reported. Now, but sometimes the assumption of the Pearson's will not be met. So, you can report this thing called continuity correction is the Yates correction. Is that okay? That's the Yates correction. Why Fisher's is there too. So you can see that Fisher's and Yates were reported because it's 2 by 2 table. Now, but look at under the table, he said 0 cells have expected count less than 5. So this means the assumption of Pearson's. Had it been that he has told us that 25 cells, 37 cells have expected count less than 5, at that point in time, I will no longer report this 23 and this. I'll report either Fisher's or Yates. I don't know if that's okay.
Yes, that's okay, sir.
All right.
That's okay. Thank you so much, sir. Thank you.
Okay. Any other question before I go? Is there any other question? Yeah, good evening.
Right. Thank you very much for the insightful webinar. Appreciate that. My question is about the multiple regression or multivariate analysis that you mentioned.
Okay.
If somebody wants to subject some variables to multiple regression to find their individual contribution, can one pick the variables from those that are significant using the chi-square, or do you have to do logistic regression for individual variables before you now subject them to multiple regression, multiple logistic regression. For example,
yeah, I understood your question.
Thank you, sir.
Okay, yeah, I understood your question. So thank you very much. Well, a number of ways. First of all, some people make assumption of what should enter the regression equation, right? So I'm talking about the independent variables now. The dependent you already know. Now, but what you want to ask is your independent variable, how do you select it? Because it's assumed that you should have done a bivariate analysis before. And then some people will say, okay, I'll pick only those who are significant to subject them to further analysis to see their strength. Some people may also write that they may take a certain p-value, but once you have a zero, some people will say anything less than 0.2, p-value less than 0 or equal to 0.2, they will also put them in the regression. So people make their assumptions, as they want. Personally, I prefer to use the one that are significant from the bivariates. Because I normally do ask myself, if I'm not related to you from a basic level, I cannot begin to test the level of relationship further, and it's also good to do their univariate odd ratio. It's good to do it. You call that unadjusted odd. Then, but the odd ratio you get after adding them together plus other covariates is called the adjusted odd ratio. So you may place them side by side, the univariate odd and then the multivariate odd. So somebody can take a look at it and see the independent contribution of this. Then what does it do when you control for other factors? That's the one that talks about the adjusted odd ratio. I don't know if that tries to answer your question, sir.
Yes, sir, I understand now.
Okay,
thank you very much.
All right. Yeah. Any other question? Is there anyone on the chat? So we can. Okay, so moderator, if there's no other question, you can make your distance. And if we're going to meet, you have to let me know. So we can sit down and do most of how do you clean your data? How do you transform it? How do you even create the SPSS? You should be able to do this basic one. Enter your questionnaire into your SPSS, enter your data by yourself, clean it up. Even if you don't know, it can save you the cost of going to ask somebody to do it. And then the same way, when you hire somebody and the person is tired, he may be putting anything for you. And that will change your hypothesis, your results fundamentally. So somebody may make a mistake and put 10. You just say it will not matter anything. You just continue without knowing that he has changed your result for you. So that's why I expect you to be able to create your code into your SPS, enter your questionnaire in your SPS, enter the results, your data as you collect them, and then be able to clean it, transform it. Then you can get a statistician if you want. Of course, you can try to analyze your data by yourself. So, moderator, over to you.
Okay, Chief, thank you so much. We appreciate this session. For some of us, we may have to go back and listen to this recording again to grab it better. So thank you so much, sir. Regarding that live session, because we discussed that it will depend on the number of persons that are willing to come for that live session, which should be holding maybe by this weekend. So we want to know if there are persons in Enugu that are willing to come for the live demonstration, the live session for the statistics, data entry, cleaning, and possibly the analysis too. So the number of persons we have here that are willing to attend, who are in Enugu that are willing to attend, will determine if that's going to hold.
Okay, so we are going to push it backwards. I'm not going to be available until the end of the month. So it's going to happen, it will happen sometime in the beginning of October. So if it's going to happen, just sample opinion among your WhatsApp group. And if it's going to happen, then you let me know. But it has to be sometime first week of October or later in October, not this month again.
Okay, sir. Okay, sir. Noted, sir. Thank you.
Yeah. Okay, so I can disappear. Thank you so much, and then have a nice evening.
Thank you so much.